Childbirth can be a beautiful yet dangerous event for mothers. Our local Bryan Health says they have strict guidelines in place to help keep you safe. New tonight, Channel 8 Eyewitness News reporter Katrina Sperl has more. Katrina?
That's right, Megan. Two leading causes of childbirth deaths and injuries are hemorrhage and severe hypertension. A report found that medical professionals are often eyeballing instead of measuring for warning signs. According to a report from USA Today, 50,000 mothers across the nation are severely injured during or after childbirth every year. They say it's because hospitals are not following long-known safety measures. At Bryan Health, strict policies and guidelines are in place to ensure swift intervention and treatment. One of their patients was Courtney.
Yes, this is serious, but we've got this under control. We're managing it.
Courtney experienced hemorrhaging with both of her children's births. She lost about 3 liters of blood during her most recent childbirth. Thanks to the care she received at Bryan Health, she was able to avoid injury and deliver healthy babies, Cameron and Emily.
The whole procedure, I felt very comfortable the whole time with the nurses just because everything was weighed. Every time they came in and did a check, all of my checks pads were weighed. They had a scale in the room, and they were in constant contact with my doctor.
One of the many protocols in regard to hemorrhaging is electronic fetal monitors. They allow for constant monitoring of laboring mother and baby from their room, nurse's station, and a secure mobile app. A nurse educator also talked about the special training they receive and simulations that help prior to the real-life event happening.
A simulation would be a high-risk fidelity birthing simulator that then hemorrhages, and we do interventions with our team to walk through that before it's in the real scenario to give exposure and experience and keep skills up.
Courtney has a message for the moms out there who may experience complications during birth.
Trust your doctors and trust your staff because they are very well educated. I never had any concerns when all of this was going on, but if there was a question, I asked.
Last year, over 3,000 babies were delivered at Bryan Health. About 0.5% of mothers were treated for severe postpartum hemorrhage, which is blood loss of at least half a liter. And good news, there were no deaths related to that.
That is wonderful news. Katrina Sperl, thank you for that story tonight.